Hello, and welcome to the Mental Health Advantage podcast, where HR, benefits, and total rewards leaders explore the future of workplace well-being. I'm your host, Stephen Sokoler, founder and CEO of Journey, the leading proactive mental health solution for modern companies. In each episode, we bring you expert insights, real-world strategies, and candid conversations on creating healthier, more productive workplaces. Make sure you subscribe so you never miss an episode. Now let's dive in. Hello, and welcome to the Mental Health Advantage podcast. Today, I'm joined by Wendy Poirier, Managing Director, Global Wellbeing Solutions Leader at WTW. How you doing today, Wendy?
I'm good, Stephen. And you?
I'm good. So now this is the part where I embarrass you. So Wendy is a true innovator in health and benefits, bringing forward pharmacy coalitions, benefit marketplaces, and strategies that embed well-being into culture. Wendy's work connects closely with what we believe at Journey, which is that mental health support must be proactive, not reactive, and built into the day-to-day flow of work. That all sounds about right.
I do. All that.
Well, I'm excited to have this conversation with you. So you've led innovation in well-being for decades. I don't know why I emphasize decades so much, but you've had an illustrious career. But what first sparked your passion for reimagining how organizations could support their people?
Well, it's a good question. I have to think back over those decades, Stephen. I think, I always had a real interest in health. And the whole word well-being wasn't even in existence, decades ago, right? We talked about health. We might have talked about wellness, but didn't really, I think, from an employer perspective, I was always involved with benefits and benefits management. And that, of course, was a lot to do with health. And in a country like Canada, it was all about sort of the fringe areas of benefits and health that we could actually affect through employer programs. So I think I was just keen to try to, influence and support organizations to recognize the importance of having healthy employees that weren't burnt out, that were high performing, that enjoyed their jobs, that kind of thing. And it was a long road to hoe, actually, decades ago. I mean, there was lots of interest, always in sort of those concepts, but often the dialogue would then kind of get back to, well, we have a disability problem. Could you just help us with the disability problem? So I did a lot of disability work before, the tide sort of shifted, I'd say, with organizations who got that maybe being a bit more proactive would support their disability numbers in a really meaningful way, actually. So I got in that way, benefits and disability, working with large employers to sort of help them understand how they could affect change in their organizations to support employees to be healthier, more productive, and higher performing.
It's funny to think back to those days. 2 decades ago, I was at a well-being summit for one of our clients, FactSet, earlier this week, and the consultant put together a timeline of well-being, right, starting with smoking cessation, 20 years ago, and then going into the rewards programs where you were compensated, which still exists, of course, incentivized to do X, Y, and Z, and just the shift over time from smoking cessation to physical health to mental health. And, obviously we talk a lot about proactive mental health, right? Preventive care. And, you've written that embedding well-being into culture is where true value is unlocked. So how can employers make that shift from programs on the side or maybe on the intranet where Mary knows where it is, but nobody else, to a proactive culture? How do they make that shift?
Yeah. So Stephen, I think we've seen a shift. We've seen them make the shift. And so it's a matter of degrees and, different employers with different sort of value systems. But I think, the pandemic was a pretty, watershed moment for well-being. I think organizations, particularly the C-suite, figured out that it was really important to keep employees healthy for business purposes, but maybe even more importantly, that they needed to be sort of transparent in their communication about what was happening, what their, what the needs were, what they were doing to support employees, the rapid shift to work from home. I mean, during those times, we saw in our employee research numbers, like the level of trust of employees was off the charts in that sort of really difficult time. And that sort of spurred on, besides the communication, also spurred on a lot of programs, right? Like there had been a big focus on physical for a long time, physical wellness, and particularly in the US, where the employer has a pretty big burden of cost around physical healthcare. But, before the pandemic, there was, again, recognition mental health is a thing. It's an important thing. It's a pretty important thing to productivity and human performance. But since then, I think mental health in particular has really sort of become a very important part of how an employer, responds to sort of that culture element. You can have great programs, you could have great practices, policies, but if you actually day to day just don't have good managers who have emotional intelligence and who know and understand how to talk to employees about well-being and about mental health in particular, then it kind of all falls apart. And I think that's what organizations sort of came to the realization and came to us and said, how do I just embed this in everyday life? Like, besides, the programs are important. It's important to take care of health across physical, emotional, financial, social, from, keeping healthy people healthy all the way to chronic, acute, catastrophic conditions. But really, what about every day? Like, after I do all those programs and hire all those vendors and have all these services, are we actually moving the needle on employee engagement and employee health? And I think that's, that was sort of the realization that it's got to go beyond the programs. It's got to be right from the top, if you can get it, leadership support, but particularly managers. They need to support their own well-being. Nobody understands, I think, until they're in it, the emotional load that management of people puts on a person. And so just understanding how to manage their own emotions, and then how to understanding how to support employees through what they're going through, how to talk to them. That's a really huge part of the culture element. And then again, just I think the other that a lot of clients that I work with have is that it maybe doesn't take having to have all that C-suite, interaction or intervention. You could actually just do it day-to-day. Team norms, establish team norms, have open communication, have transparency in your communication, have a great navigation system so you can get employees to help when they need it, but also having a manager who knows what kind of programs and practices you have to help them navigate there. So those are, I think, some of the elements of culture. I think that kind of can more easily, I guess, be brought into the picture.
Yeah, absolutely. I mean, we talk a lot about this at Journey when we're talking to prospective clients and clients, like the benefits are just the start. You can put in the best benefit in the world. You could put in Journey or Lyra or Spring or any of us. But at the end of the day, if the employee is expected to do the work of two people, if their manager, speaks in a way that's disrespectful, if there's, a lot of stigma around mental health where somebody who had a broken arm could say I have a broken arm, but if somebody's struggling with anxiety, they couldn't, express that, or they don't have permission to take time off, or, et cetera, right? It's going to be very hard. And one of the things that we believe at Journey with our own team is, people don't quit companies, they quit managers. I mean, people can quit companies, of course, but your manager makes a huge difference in terms of the well-being. And so we work really hard to work with our clients to make sure that their managers feel really supported. How do they take care of themselves? How do they know what to look for? How do they approach skillfully, thoughtfully, and direct people to the right resources? So that's a mental health certification program that we built for Lululemon, that we've rolled out for Pfizer and Regeneron, a bunch of other companies, because recognizing that those managers need that support.
Yeah, no, that's huge. That's a huge part of, I think, what's been missing in the past, for sure. Something that's I think really valuable. And I haven't seen, the details of your program, but I see a lot of organizations saying, well, maybe it's mental health first aid I need to give my people. And that can be pretty onerous, to be honest. Like it's a great program, but it's not for everybody. And so having a more tailored, manager specific, more succinct, more direct, like what they need as a manager, as opposed to the whole mental health first aid training, I think is a great option.
Yeah, I'm laughing because it's funny you mention that. That's actually how this program came about. So Lululemon did mental health first aid in the UK, in Canada, where they're based, and in the US, and said, we want to roll this out to all our managers and then eventually to all 20,000 employees. But exactly what you said, we need something that's a little bit more contained. We need something that's more modern and diverse and personalized and customized. And so they came to us as a longtime partner. We've now taught that partner in French in Canada, in Mandarin in China, in Spanish in Mexico. And it's one of these things that's really making a difference in terms of supporting the managers and then, of course, the employees. So yes on that. And so as you think about this shift, from programs to culture, how does this align with the growing move away from traditional reactive EAPs to EAPs that are more modern and proactive in their approach?
Well, I mean, it seems like it's a bit of a like chicken and egg, which came first, right? I mean, EAP's been around for so long, right? As we both know, decades, and really filled a need decades ago that was pretty narrow in terms of what employers needed. They needed help with, critical incidents that happened. They needed help with drug and alcohol, substance abuse issues. Those were sort of the prickly issues that they didn't want to get involved in. And that's what an EAP did. And then, the counseling came on top of that, the short-term counseling, work-life services, then coaching. When employers looked at what was happening with utilization, right, which was very low for decades and decades and still is, right, in many places. I think the realization was like we have, 100% of our employees have mental health, just like physical health, and we're clearly only reaching a small portion of those people. So what's the magic button that we need to get this kind of a tool? First of all, to get a better tool, to get a better list of services, to have a better, like you said, more modern approach, tech enabled, all that kind of stuff. How do we get that into the hands of employees? So I think as organizations like yourself or Lyra or Spring kind of came up with a model that was much more designed with like the normal person in mind, or the average person, or the person who's not just in critical need, but also maybe doesn't need counseling, needs a coach, wants to chat, or text, or find a provider that actually matches their own particular needs. Like all of the things that I think came up from the new models that you're pioneering are exactly what employers were sort of scratching their heads and looking for when they saw the EAP. And it was just kind of a needed to play, but didn't really have a big part in the game, I think is what they were sort of realizing.
Yeah. For us, I mean, we've been doing preventive proactive care for a decade, but really now with AI, which is another conversation that we can have, it really allows us to do much more in being able to recognize when people are in need, even before they do, right? Because I think we all know this, that the human nature is one where we don't often raise our hand when we need help, right? And, different people are better than this. Women tend to be better than men, right? In terms of actually asking for help and getting help. But it's one of these things where just societally, we just sort of power through it, right? Or we just suck it up. Or we might not even be aware as we're sort of spiraling downwards. And so being able to proactively reach out at key times to just remind people, hey, support is available. Hey, what about this, right? Keeping people healthy versus trying to treat it. We already know that when it comes to physical health, but when it comes to mental health, it's the same thing. So you pioneered Canada's first pharmacy coalition and benefit marketplace. And so when it comes to innovation and disruption, what lessons can employers learn about disrupting legacy models?
Disruption, and you're a disruptor, Stephen. So I'd maybe throw back the question at you after this. But and I've actually used you in the context of, hey, you're a disruptor in the marketplace, and that's a good thing. I think first, like as a disruptor, you've always got to like take into consideration that there's going to be the naysayers. There's going to be the folks that are just not going to, be on side, and sometimes there's just going to be that wall that you hit, with certain people. And I think employers are the same. I think employers could have embraced disruption sometimes, and other times they're just not ready. And I think when they recognize the need for disruption, but don't think that their organization is ready. So I work with a lot of big global clients. They maybe have recognized the need, for instance, in the disrupted EAP system in the US, but they can't see it, taking part outside the US and some of the other countries. And I think they have had to learn that it's okay to actually to test those waters and maybe to pilot in a few countries. And if it's working in the US, why wouldn't it work somewhere else? So sometimes embracing disruption, I think, as an employer is a hard thing to do. And then with other organizations, they're ready. Like they've had enough. They've had enough negative experience, or they've had enough with, time without getting any real return or value on the investment they're making, that they're ready for it. Even then, there's always bumps in the road. There's always like adopting a different model is not always an easy sell, from a cost perspective, perhaps, or just from a, what this can do and how this could be marketed to employees. So, I mean, I think all around there's, again, just some organizations who are ready for it, and then some who still want to wait another 5 to 10 years to see if it works. So you've got to sort of pick your battles there, to be honest.
Thanks for listening to the first half of the episode. I hope you're walking away with some valuable insights. I want to take a quick pause to tell you about my book, The Mental Health Advantage. If you found this conversation useful, you'll find 300 more pages packed with strategies, insights, and real-world applications. Grab your copy on Amazon. Just check the show notes for the link. And if you're looking for a more comprehensive mental health solution for your company, let's chat. You'll find another link in the show notes to reach out and explore how Journey can help you. Now back to the show. My biggest challenge on our side is just patience, because you're explaining to people something new, and some people get it right away. And some people, it takes time for them to get it. And other people don't want to get it, right? They're like, well, why would we buy this thing called a car when we have horses? And it's like, well, lots of reasons, right? And so when we talk about things, it's, human beings, it's hard for us to change our mind or our point of view if we've always seen things a certain way. It's also helpful for me to say that honestly, just because I am not patient by nature. So, understanding that it does just take a little bit of time.
Yeah. And sometimes there's really positive unintended consequences. Like, you talk about the Pharmacy Coalition. It actually didn't really work for very long in Canada, the whole coalition, but man, it changed the way that pharmacies deal with employers and the way that employers expected, to be dealt with, as a big buyer of pharmaceuticals. So I was happy with that. As again, I was impatient to make a change and then put something out there that was pretty innovative, and it changed the paradigm for, and I think that's something to be proud of. It's something that's worth the patience. Stephen.
Yeah, well, that's actually when I talk about like the why. My why is, how can we create a different environment that people will inherit when they get into the workplace? To say it differently, how do we create a different environment today? But there is a different expectation now than there was 25 years ago when am I dating myself? Yeah, 25 years ago when I got to the place, which was different than when my parents got in, which is hopefully going to be very different than when my 2-year-old son gets into the workplace, So all these things where, how can we provide just a better environment for people where it's healthier and more humane and more just easier on the mind and the body and the soul, while also driving performance of companies, right? As a CEO, obviously that's important for me, and it's important for all of the people leaders that I deal with. But that why of, how do we make a bigger change that's not just about Journey or our day-to-day or our clients, right? How do we idly shift something, which it sounds like you were able to do? So where do you see innovation heading, particularly when it comes to mental health and proactive well-being?
From an organizational perspective, I see some pretty big gains, around addressing stigma with mental health, but still a long ways to go. Like you said, I think there is still a lot of, maybe not so much sticking the head in the sand, but not paying enough attention to really addressing the need to educate on mental health, as well as address the stigma, both, organizationally, but also individually, right? Like I'm always amazed at the lack of knowledge in some ways about what makes us tick as human beings, how important, that mental part is. And I think that there's, lots of ways that we're continuing to sort of innovate to get organizations to think that way and to act that way, that mental health matters, and connect it to all sorts of other things. And I think this is still where innovation has to come in, how it gets connected to sleep or nutrition or fitness or day-to-day activities, in an office, how it's connected to flexible work arrangements. That's a big one these days, right? How much of an effect does it have when those things are pulled back, and, how that sort of plays out. So I think that we still need to innovate around some of those things. I still think there's a lot of room for, organizations to innovate in how they adopt, mental health into the whole career life cycle, from the very beginning, joining as a new joiner all the way to retirement, and embedding it like they do other things, connecting it to financial well-being. I think that's another place that we need some more innovation. And I see some of that, coming to the fore. There's, especially these days, financial well-being is, in our data anyway, it tops mental health as the number one concern. But obviously, they're inextricably linked, as we say, right? So, finding ways to innovate around connecting those those two issues, the biggest issues I think that our employees are facing. I think that's another area.
I agree. Let's transition a little bit into talking about measuring value. So, in your piece, Driving Value by Protecting Wellbeing, you emphasize the link between well-being and performance. So, how can proactive approaches prove their value beyond cost savings?
I think proving value is often comes up in employee listening exercises. Organizations, I think, are doing a good job expanding things like their employee engagement survey to ask the right questions about, are you being taken care of by your manager? Does your manager care about your well-being? Does your organization care about your well-being? How does that affect your performance? Does that mean, that we're looking at data that sort of talks about how many days a week do you think that you're productive, and associating that back to whether or not they're feeling supported by leadership, by management, by their coworkers, however that, whichever group that they're sort of measuring against. So I think a lot of measuring sort of that proactive interface is about how much less reactive things they have, how they're moving forward on some of the sort of metrics that they measure as organizations. Some of those are financial metrics. We know from our Wellbeing Diagnostic Survey, for instance, that we see companies who are high performing in the well-being categories, and those are emotional, financial, physical, and social, and in the employee experience, that they actually have better financial metrics. We also see lower healthcare trend in those kind of companies. So there are some numeric, I think, measures that you can put in place, but also just getting into, employee sentiment, employee engagement, and just listening to employees and understanding whether or not what you're doing is actually having an effect on their performance is probably the key.
Wendy, what leading indicators should leaders watch for, look out for, to know that they're getting it right when it comes to this sort of stuff?
Yeah, Stephen, I think that the biggest leading indicator is actually having high performance teams that continue to be high performing over time, that don't suffer from burnout, that are not, that you're not losing people. So, that you're not just attracting, but you're retaining and engaging those people and continuing to have high performance. So as an example, with the pharma company I work with, they are very focused on making sure that their high performing teams understand what it takes to be high performing, both from a business perspective, but also from a physical and very much mental health perspective. So their goal is to have those people understand that it's, even in a high performing organization, you need to take breaks. You need to take care of your mental health. You're going to have times where it's, you've got stress and anxiety and personal issues or work issues, and that's all okay. And to work through it, they have the tools and the support to work through it. They train managers to identify those signs of stress, and they openly have dialogue, that supports those people to continue to be high performing. So having high performing teams that continue to do the work and give them success as a business is pretty much a leading indicator of good mental health support.
Absolutely. So your role is global, and I'm sure we could probably spend a whole podcast just talking about this, but what differences do you see in how well-being is currently being approached in different countries and regions?
Yeah, there's lots of culture and nuance around well-being, and then probably even more so around mental health. The U.S. has long been, particularly U.S. multinationals, I think, have long been sort of leaders in addressing physical and mental, maybe financial well-being. But there's lots of pockets across the world that actually do a really good job at that too. And then there's certain countries, there's certain regions where it's still hard to address. So in Asia, it's still pretty hard in some countries to address mental health straight on. And so it's done more through adjacent issues like sleep or nutrition or family, reaching out to family members as opposed to the workers. In places like Latin America, it's, where there's lots of hierarchy. It's helpful to have a well-being approach that comes from a supervisor, or direct manager, not the C-suite, somewhere else in some other part of the world, but the actual regional or country level person showing up and talking about well-being or talking about mental health in particular. That actually has a really big effect, So I think, in Europe, I think there's been a real shift around well-being. There's a lot more organizations that sort of recognize it as, a key performance indicator for them and for their business. And I think that their main issue in Europe was always that employees don't want us involved in their financial well-being or their mental health or their physical health. Again, the US has always kind of had that ability to be involved in physical health because you pay the bills. But in other countries, that's not always the case. And in Europe, there was very much a shift in the last, probably since the pandemic, very much more of a shift towards employees being very vocal that they trust their employer. They want to hear from their employer. If they get education and training on any aspect of well-being, they're going to believe it from their employer. So it's a bit, of a shift for a lot of organizations to say, oh, okay, if you want, we'll certainly get involved and we'll support you in all aspects of your well-being. But that wasn't always the case. I think that employees were a little more reluctant to kind of look to their employer for that kind of advice.
Yeah. And since we're both based in North America, and probably a lot of our listeners are, let's speak about that. How can employers here learn from international models that are embedding well-being earlier and more proactively?
Well, I think the lesson is just, again, find that sweet spot of and I think that some North American organizations do this well. Like I work with, an engineering company that uses well-being like in their university and college recruitment process, right? Like they embed it early in the career life cycle, right? And so even in attracting employees, they talk about how this is a differentiator for them and how they, connect to the UN sustainability model and how they really, focus in on all aspects of well-being, but particularly around mental health. So I see more organizations sort of doing that. I think there's still, again, this has come from years ago, decades and decades of organizations saying, well, why would I support a gym or gym membership? Like only healthy people will go there. And what's wrong with keeping healthy people healthy? Keeping healthy people healthy physically, emotionally, financially, socially is really actually a great strategy. And I think that's something that in organizations in North America, actually, particularly in the US, I think they've thought about it for a long time. They've mostly connected that to things like incentives. And I think now there's some speaking of disruptions, I think there's some interesting thinking around how do we disrupt that system to truly get, more early intervention and early support into the well-being ecosystem.
Yeah, absolutely. If you could redesign one workplace well-being program or practice tomorrow, what would it be and why?
Well, I can't say the EAP anymore because it's finally done. How's that?
Yes, we've checked that box. Yeah.
We finally, Stephen, checked that box. That was forever. Honest to God, that was my pet peeve was the EAP. If we could just do something with the EAP model, and we have. So now, what should we attack? Good question. I don't know if this answers the question fully, but I really like the psychosocial safety standards and the model. And if I could get employers to really buy into the fact, and in some countries it's now regulation, right? And Australia has a big rag about it. I know in Canada we have a national standard. It's not a regulation. But if I could get more organizations to really sort of understand what are psychosocial safety risks and why that's important and how to address that, I think that would be a huge improvement.
I love that. I have a close friend named Chris Shembra who does some great talks about gratitude and a whole host of other really important and human topics. And he and I were talking the other day, and he was talking about how, going back to the conversation we were having at the beginning, like the shift from physical well-being, where it was coaches and personal trainers, to mental and emotional well-being, where it was therapists. And now he thinks the next generation will be around social well-being, where it'll be the gatherers, the facilitators, which is actually quite interesting because, we've all seen the studies on the loneliness epidemic, how being lonely is the equivalent of smoking, so many packs of cigarettes a day. And so we tend to be living more isolated individual lives versus what we led in the past when we were working in office, when we lived in community, when we were going to church or mosques or temples or what have you. And so we're just living different lives. And so there's something to that it's not exactly the question that I asked you in terms of a workplace well-being program. But when I do think about the shift, there is some level of connectedness that I think is very important for well-being and then, of course, thriving at work. All right. Well, we are just about at time. So, Wendy, I want to thank you. Thank you for your time, for your insights. Anything else you want to share with the audience today?
Yeah, I mean, I just think that it's like that, age old saying that every, journey starts with a single step. And it's, be the change you want to see. I think all of us, and it goes back to the whole culture thing, organizations are struggling to really, particularly the HR departments are struggling to how do I make this real? How do I make this an everyday thing? I liked your thought about just being gratitude, being kind, just the little things that make so much difference to people's mental health and to the whole sense of community and addressing loneliness, et cetera. So just be the change.
I love that. Well, Wendy, thank you again for your time, for your insights. It is very much appreciated. And thanks everyone for listening. If you enjoyed this podcast, please give it a thumbs up, share it with a friend, and have yourself a wonderful day. Thanks for spending this time with us. We know you're busy. If you enjoyed today's conversation, be sure to subscribe to the Mental Health Advantage and leave a review. Thanks so much and have a beautiful day.